Hello, I am Dr. Saurabh Joshi, founder of the Vein Center. First up, I would like to thank you for booking an appointment with us. And we realized over thousands of patients that there are some common, frequently asked questions. So, which I would like to discuss with you beforehand. And if you see this video in its entirety, most of your questions would be answered before you actually come in for the OPD. So, here are some questions that patients ask us frequently. Uh, Most common is what is varicose veins and varicose ulcers. So varicose veins, when we say the word, it immediately in front of our eyes we see these big bulging veins on the legs. So although that is the most commonly common presentation of varicose veins, but it doesn't mean that those who don't have these bulging veins don't have varicose veins. Sometimes varicose veins can be hidden inside the soft tissues. Sometimes even thin people can have swelling and pain in the legs without actually seeing the popping out veins on the legs. So this is either the bulging veins or symptoms like swelling, cramps in the night, or skin discoloration. That is also lead or one of the signs of varicose veins. Varicose ulcers are a further severe stage of varicose veins, and it just means a wound developing because of varicose veins. And typically varicose ulcers heal very slow, and there is a classical appearance of varicose ulcer which cannot be missed. Typically patients say that this wound is taking a very long time to heal. This wound happens mostly below the mid calf on the inner part of the ankle, or it can happen anywhere else also, and is accompanied by some skin darkening or discoloration, but that is not compulsory. Even without darkening, if you have a wound on the leg which is taking a long time to heal, then a venous cause must be ruled out. So that is about what are varicose veins and varicose ulcers. What are symptoms? Symptoms of varicose veins are swelling, pain, cramps in the night, skin darkening, majorly on the lower part of the leg, loss of hair from the mid calf down, also wounds on the legs that take a long time to heal. And so more questions are, what causes varicose veins? Why me? Why does it happen to me? So varicose veins can happen without any reason. 30% of the population have weak valves in the veins, so it can just happen even without any risk factors. But otherwise there are some risk factors for varicose veins, that is either sitting or standing for a long period of time for many years, obesity, being heavier than normal for a long period of time, any past injuries to the leg like fractures or open surgeries to the leg increases our risk of varicose veins. Women with 2 or more than 2 full-term pregnancies are also known to have a higher risk of developing varicose veins. Also, people with family members, if a family history of if your parents have varicose veins, then you might have a higher risk of developing varicose veins. So how are these diagnosed? How is varicose vein diagnosed? So diagnosis of varicose veins, by clinical examination we can see the varicose veins are bulging, or we can see that the patient has a wound on the leg, but that is not enough. In addition to that, we have to do a scan of your leg veins to identify the varicose veins, to know if there is any clot in the vein or not, to know the size of the vein. So at all our operating places, even if you are seeing me or any of my colleagues who are going to see you for the OPD consultation, if it is relevant, they would be doing a venous Doppler ultrasound right there, and either me or any of my colleagues, and that will give us a status of your varicose veins immediately, and thereby we can either treat you by medicines if there is any infection or any clot in the veins, or we can straight away plan any procedure which is required. So what are the treatment options of varicose veins? In the earliest stages, we can give compression garments like varicose vein stockings or crepe bandage application that improves the blood circulation. Once the veins are much larger in size, or once the patient starts developing skin darkening or a wound on the leg, and there are some ultrasound parameters that are there, if that happens, then we need to actually do something for the varicose veins. Now, there are various modes of treating varicose veins currently available. The older ones are the open surgical procedures, varicose vein stripping or ligation or excision surgeries. These were open surgeries with some need for stitches, a full anesthesia, longer recovery and a higher recurrence rate. Then came the needle-based procedures. The needle-based procedures are a little bit older ones, which are the thermal ablation procedures, either laser treatment or radiofrequency ablation. So what these mean is by some method introduce a device into the leg veins and heat the veins to burn and close them. So if you are heating and burning them, it requires some kind of anesthesia, otherwise it hurts. The most common way anesthesia which is used is either a spinal anesthesia or even a general anesthesia. Now, in doing so, we also have to give multiple needle pricks to give saline along the length of the vein to protect other structures from burning. So this was thermal ablation, and the current latest way of treating varicose veins is non-thermal ablation, where is a way of treating without actually burning the veins. The various ways of doing this, the most advanced way of doing this is a procedure called VenaSeal closure system. So what this does is like an angiography, a catheter is introduced in the vein from the ankle up to the hip, and then we inject a medicine through the catheter and then press the vein from top. This closes or seals the vein instantly from the inside. It is not a painful procedure. It does not require a spinal anesthesia. It doesn't require a needle in the back. And as compared to laser, there is lesser dependency on stockings for these. Some patients would require stockings for a longer time depending on the size of the vein, if there is concurrent sclerotherapy or not. So again, what are the differences? What is the difference between laser and VenaSeal? So this is again a common question which is asked. The differences are: in laser we are burning the vein, in VenaSeal we are not burning the vein. In laser we have to give a full unconsciousness or a spinal anesthesia, which makes elderly patients slightly at a risk. In VenaSeal we are not burning, it doesn't hurt to do, that's why we don't need to give a full anesthesia. So an elderly patient who has other health issues this can be done safely. And other than that, a lot of needle pricks and a lot of saline, up to 300 to 400 ml of saline each leg for laser, which is injected to protect the other tissues, which is not needed in VenaSeal. So then that also reduces the risk for an elderly patient. And if we are doing this for elderly and it's safe for elderly, we can do this for everybody. There is there's a chance of nerve burning or peripheral neuropathy with laser, which is not there in VenaSeal. And so when I do the procedure, how soon can I walk? So with laser it takes some time to walk because you are under anesthesia. With VenaSeal, patients just walk off immediately. And what is the recovery process like? So for all our patients, like the scan which we are doing right now for your first appointment, we would be doing the same scan at 7 days post procedure, 2 months, 6 months, 1 year, 2 years, 4 years. There's a regular follow-up which we offer our patients so that we can monitor your progress and answer any queries in between, or offer any treatments in between if required. Is this covered in insurance? Yes, of course it is covered in insurance. VenaSeal closure system is a FDA approved procedure, and we are now crossed more than 10,000 OPD patients. Most of our operation patients do claim from insurance in one way or the other, and it is covered in insurance, of course. How can I prevent my varicose veins from worsening? So if you have the early stages of varicose veins and the procedure is not been advised for you, then maintaining a healthy weight and doing some regular exercises, and if you are standing for a long time, wearing compression stockings would prevent varicose veins from worsening. So those were our FAQs. Please do see the whole video so that this will help answer most of your questions which you would otherwise ask in the OPD. That will give you some peace even before you start coming and seeing us. Thank you.